Hello, you may have just had a baby or about to, and in this season of sleeplessness and exhaustion, you just want to know what are your options for contraception in this postpartum period.
Yes, so there are pills, the patch, the ring, the shot, IUD, implants, tubals, natural family planning. We are going to cover it all today and how it plays into breastfeeding or pumping if that's something you are planning. If this is your first time meeting us, I'm Sarah. I'm a board certified OBGYN, a fertility specialist, and have two little toddlers, both of whom I breastfed.
Yep, and I'm Kurt. I'm a board certified pediatrician, dad to those same two little toddlers, and we are the Doctors Bjorkman.
Welcome back. Something your OB provider will likely start talking about during your pregnancy is what you want to do for birth control after you have your baby.
Yes. Now, we've recently just talked about pregnancy spacing in a video all about when that perfect time is to have that next baby.
Yes.
But to summarize that, studies have shown that a minimum of about 12 to 18 months may be ideal between pregnancies, and like really working to avoid those short interval pregnancies of less than 6 months if at all possible.
Yep.
And that seems to reduce the risk of preterm birth and low birth weight.
Right. So why is your OB bringing this up to you while you are still pregnant? Well, non-breastfeeding women can ovulate as early as 25 days postpartum, and about 40% will ovulate by 6 weeks postpartum. Add to that 50% of women are sexually active by 6 weeks. There is a possibility that you could get pregnant very shortly after giving birth. Studies have also shown that up to 40% of women may not make it to that 6-week postpartum visit with their doctor. So this is why your OB is going to start talking about it while you are pregnant, and it's going to want to have a plan for you as soon as possible.
So what actually are those options for birth control after having a baby?
Well, the options are truly just about the same as those available pre-pregnancy: pills, patches, rings, the shot, IUD, implant, tubal ligation, natural family planning. But each of these have some special considerations in the postpartum period that we want to share with you. Things like the effect on breast milk supply or the potential for increased risk of blood clots with some of the options. So we're going to go over that today.
Yeah. Now, one of those things is that estrogen-containing birth control, certain pills, patches, rings, etc., is avoided for at least 6 weeks postpartum. And this is because the postpartum maternal body already has elevated estrogen levels, and adding further estrogen to that can increase the risk of getting a blood clot.
Yeah. So in those first 6 weeks, your doc will talk to you about progesterone-only methods or hormone-free options. The other reason we avoid estrogen early on is because there is some data that suggests that it may decrease milk supply. So if you're trying to breastfeed, we want to avoid anything that might impact that breast milk supply as you're establishing it.
Great. So with that, let's talk through some of those other options. One of the most commonly prescribed options after pregnancy is a pill. As Sarah mentioned, immediately postpartum, it should be a progesterone-only pill. And now the pros of this option is that it's pretty easy to take a pill every day.
Right. The cons of that are that you have to remember to take it every day at about the same time, kind of within a 3-hour window. And when you are newly postpartum, it is hard to remember to brush your teeth, let alone take a pill at the same time every day. Or maybe that was just me. There's also a theoretical concern related to milk supply when progesterone options are initiated in that initial 48 hours after delivery, because a drop in progesterone levels after birth is necessary for certain processes in breast milk production and getting lactogenesis started.
Yeah. Now, reassuringly, there was a 2010 systematic review of the effects of the progestin-only contraceptive options when initiated after that initial postpartum period. And so in these studies, they looked at 5 randomized controlled trials and 38 observational trials looking at this topic, and they found no adverse effects on breastfeeding through 12 months of age. So with all of that, could you talk a little bit more about the concern about milk supply?
Sure. There is a bit of controversy in the literature about hormonal contraceptive effects on milk supply. So for progesterone, one study has reported an increase in supply. Another noted a 12% decline in milk supply with progesterone-only options. And as mentioned, some other big studies have found no effect. As for estrogen, the potential for estrogen to cause milk suppression is more clear. And part of this is historically, doctors sometimes used large doses of estrogen immediately postpartum to suppress lactation. And it was quite effective. So this was prior to our understanding of that increased risk of blood clots during the immediate postpartum period, but it highlights that estrogen can decrease milk supply.
Yeah, and as you mentioned, there really isn't a ton of data out there. 2010 systematic review on combined oral contraceptives.
So that's estrogen and progesterone.
Yep. And their effect on breastfeeding found there's really only 3 randomized controlled trials at that time and 4 observational studies. And the RCTs found a decreased kind of average breastfeeding duration in that combined oral contraceptive users and an increased use of formula supplementation.
Yeah. There was a study done by a WHO task force in the 1980s, and they found about a 42% decrease in supply in women who were using the combined oral contraceptive pills within 6 weeks of the initiation of those pills. But it's important to note the amount of estrogen in today's combined pills is much, much lower than the amount of estrogen that was used in those early studies.
Yeah, indeed. There's another recent randomized controlled trial comparing 63 women using a progestin-only pill versus 64 using a combined pill that contained estrogen. And they followed them through 8 weeks postpartum. And this study found no difference in continued breastfeeding at that 8-week mark.
Yeah. It's important to note that 44% of those in the progesterone-only group stopped breastfeeding because of a perceived insufficient milk supply, compared to 55% in the combined estrogen-progesterone birth control group. 23% of women who stopped their pills in the progesterone-only group and 21% in the combined group reported that they did so because of perceived negative impact on milk supply.
Yeah, now the take home there with all those numbers that until better evidence exists is that it's really best to advise women that hormonal contraceptive methods may decrease milk supply, especially in the early postpartum period.
Yeah. The Academy of Breastfeeding Medicine recommends that hormonal methods should be discouraged if you have 1, existing low milk supply or a history of lactational failure, 2, a history of breast surgery, 3, you have multiples, you have twins or triplets. 4, if you have a preterm birth, they recommend to avoid. And the 5th thing is compromised health of mom or baby. It's best, the other thing is that the recommendation is it's best to start a hormone containing option once your supply is well established, and that's usually after that 6 to 12 weeks postpartum, and to do so at the lowest dose of estrogen possible.
So just to make sure I can understand all of this.
Yes.
Estrogen containing pills in the first 6 weeks after baby comes is not ideal because of the increased risk of blood clots.
Correct.
And also decreased milk supply, which makes progesterone-only pills the preferred pill option.
Immediately postpartum.
Okay.
Yep.
But those progesterone-only pills might also affect breastfeeding if started before the milk supply is fully established.
Much less clear on progesterone only. Progesterone only, the mini pill, that is pretty standard if you want to be on a pill for those first 6 weeks.
Okay, great. Then let's talk about the other options too.
Other great options are what we call the set it and forget it methods, like the IUD, intrauterine device, or the implant. The IUD is a little T-shaped device that is inserted into your uterus. Sometimes this is done immediately after delivering your placenta, but most often it is done at your 6-week postpartum visit. There are 2 main types: progesterone-containing IUDs and copper IUDs.
Yeah, and there's some important differences between these two, right?
There are. So some IUDs, the Mirena, Liletta, Skyla, Kylena, these all contain the hormone progesterone. They are extremely effective at preventing pregnancy, and they can be used anywhere from 3 to 8 years. They prevent pregnancy and fertilization by changing the amount and thickness of the cervical mucus and kind of make it impenetrable to the sperm. Most women do ovulate normally, but experience less bleeding because of the local effect of that progesterone on the endometrium in the uterus. These are 99.8% effective, and importantly, studies show no impact on breastfeeding if these are inserted at that 6-week postpartum visit. So yes, this IUD contains progesterone, but the it is a local hormone and works at the uterus. The progesterone in those pills is a systemic thing. So studies show with the progesterone IUDs, no effect on breastfeeding.
Great. Now, the copper IUD, or Paragard, is hormone-free. This copper IUD prevents fertilization by creating an environment that is really just hostile to the egg and sperm.
Yes.
It inhibits sperm movement and migration. It changes the speed that the egg can transport and also possibly causes damage to the egg itself.
Yep.
The most common adverse effect with the copper IUD is some abnormal bleeding or pain, but it also is greater than 99% effective with a 1-year kind of typical failure rate of less than 1% or less than 1 in 100. The other benefit of the copper IUD is it's good for up to 12 years of pregnancy prevention, and importantly, this option is hormone-free, so there's no effect on milk supply or breastfeeding.
The other set it and forget it method is the etonogestrel implant. It's a progesterone only implant called the Nexplanon. So it's a 4 centimeter by 2 millimeter thin flexible rod, about the size of a matchstick. It kind of feels like a pencil lead, and it's placed here under the skin of the arm, kind of under the bicep, and it works by preventing ovulation. It also thickens cervical mucus and alters the endometrial lining. So after the implant is inserted, changes in bleeding patterns are common, and these can include, people kind of end up in one of 3 buckets. One of them is amenorrhea, or more infrequent periods. Some end up in, hey, their bleeding pattern is about the same, and some have just kind of random irregular bleeding that can be kind of annoying. It is 99.9% effective, and the 1-year typical failure rate is about 0.05 per 100 women. This implant can be placed in the hospital immediately postpartum or at your 6-week postpartum visit.
Now, in terms of breastfeeding effects, there was a study done in 2015 where they took 24 postpartum women and their newborns and randomly assigned them to either a group of no contraception or having a Nexplanon implant, with 12 being assigned to the treatment group and 12 in the control group. They inserted the Nexplanon in the treatment group at 24 hours after delivery and then measured the amount of breast milk the newborn took in the first 6 weeks. The average breast milk intake was similar between these two groups, both in the first weeks after delivery and then at that 6-week mark. And this study concluded that there was no effect of significant alteration to breast milk intake in these newborns with the implant of Nexplanon. With this newer data suggesting that this implant is probably a pretty good option for breastfeeding.
Yeah. The biggest cons of the implant are that you have to have a little procedure to have it inserted into your arm, and then you have to see a doctor to have it removed. So it's not like you can just stop this one on your own.
Now, you can also get a shot that lasts 3 months, correct?
Yes, Depo, or Depo-medroxyprogesterone acetate. This is a progesterone injection that lasts for 3 months.
Very cool. But does this affect breastfeeding at all?
Well, many of the early studies done on this are pretty low quality. However, a prospective case control study of 150 women who were receiving Depo after the initiation of lactation, but prior to hospital discharge, so this is somewhere between 2 and 10 days after they had their baby, were compared with 100 women who were not receiving hormonal contraception, and they were followed up to 6 months. They found no difference in the satisfaction with the breastfeeding experience or infant growth, although it is unclear how the breastfeeding patterns compared.
Gotcha. Now, there's another study that quantified the association between postpartum Depo and early breastfeeding, like stopping early breastfeeding, looking at 183 women. And this study concluded that if there was a causal relationship between Depo and breastfeeding duration, it's really probably minimal at most.
Yes. The one thing about Depo is that sometimes after stopping those injections, it sometimes takes a few months to a year before patients start ovulating again. With the pill, the patch, the ring, the IUD, once you stop taking it or you take your IUD out, you can start ovulating right away again. With Depo, it can be variable after stopping.
Now, what about other pill or device-free options?
There is the LAM method, or lactational amenorrhea method. So this is a method for moms who are direct breastfeeding at least every 3 to 4 hours. They have not resumed having periods and their baby is less than 6 months old. So if all of those things are true, there's only a 1 to 2% chance of pregnancy, as that amount of breastfeeding suppresses ovulation very well in that early, less than 6 months postpartum phase.
Gotcha. It's important to note that this has not been studied for women who were pumping or using formula supplementation.
Yes, and again, fully breastfeeding means that at least every 4 hours during the day, no more than 6 hours at night, periods haven't returned yet, and we are less than 6 months postpartum. Also, after you return to having regular periods and ovulating, you can also use the natural family planning or a fertility awareness method to avoid pregnancy. This can be a little trickier if you are breastfeeding, as ovulation is sometimes less predictable when breastfeeding. There are no side effects to this method, and it has no impact on breastfeeding, though some moms do notice lower milk supply during their periods.
Interesting. Now, there's also barrier methods. This is things like condoms, diaphragms, etc. These are not nearly as effective as an IUD implant or pill, but this is a great option if you don't want to use anything that contains hormones or any of the other available devices.
Another option is sterilization for the male or female partner. If you are certain your family is complete, women can get their tubes tied, or men can have a vasectomy. The biggest risk with these procedures is the risk of regret. These are permanent methods of sterilization, and while there are vasectomy reversals or tubal reversal surgical procedures, they sometimes don't work and are very expensive. The perks of sterilization are that it's permanent and highly effective. The cons are that it is a surgical procedure for women and an outpatient surgical procedure for men.
Yeah. Now, one additional positive benefit of these options is that they do not affect breastfeeding, obviously, and they do not require any exposure to outside hormones.
So what did I choose? After our first pregnancy, we said, hey, we really think we want to have kids close together. And so did lactational amenorrhea method. It was right around that 6-month mark that I started ovulating again and said, hey, let's start trying again. Interestingly, we ended up having secondary infertility thanks to some male factor infertility. So then we went down that whole journey. So with baby number 2, what was my thought process, as an OBGYN and a breastfeeding mom? How did that look? So with baby number 1, I kind of had a low milk supply, and with number 2, it was kind of an exact producer. And so I was hesitant to try hormonal methods just because I was working so dang hard for breastfeeding. I didn't want to do anything that could potentially decrease supply or cause any issues. I've had patients who do great starting their oral contraceptive pills at 6 weeks with estrogen, and they do fine, but I said I am going to wait until breastfeeding is well established, and did not want to start any hormonal methods till 12 weeks or beyond. Barrier methods are not as fun. Fertility awareness made me a little bit nervous, just because when you're breastfeeding, it's hard to tell kind of what's going on. So was kind of thinking about, I'd had an IUD prior to getting pregnant with Cease, loved it, so nice to not think about it. Amenorrhea was a great side effect. So that was kind of my thought process. We always say, though, if you are not contracepting, you are trying, even if you have a history with fertility issues. So I will leave you with that little choose a contraceptive method and choose it early, and we will talk more about that next week.
So that was a not so brief look at the options.
Correct. So the Sparks Notes version is this. If you aren't breastfeeding, you can pick whichever method sounds best to you. You should avoid estrogen for the first 6 weeks, but after that, there is much less nuance to consider.
Yep. Now, if you're breastfeeding, the studies have shown that an implant and IUD placed 6 weeks postpartum does not affect supply of breast milk.
Yep.
But be cautious with hormone-containing options, especially early postpartum while the milk supply is not yet established.
Yes. So that is all we have for you this week, and we look forward to seeing you next week.
Okay. Bye, guys.
Bye.
We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.